Why don't concierge clinics accept insurance? And what's the deal with prior authorizations? Let's dig into it. Prior authorizations are little stalls presented in your funnel of care by your insurance, which require your provider to justify within the FDA guidelines why exactly they're prescribing or recommending what they are. Particularly for people needing hormone replacement therapy, these guidelines are designed by the FDA and medical community to be very restrictive so as to reduce the burden of cost to the insurance companies. When medications are prescribed or used in a way designated as off-label by the FDA, which is where proper hormone therapy falls, the insurance company simply will not cover it. These prior authorizations are a business tactic used by the insurance company to save money. They insert themselves into the provider-patient relationship, which is where the best care for that patient is decided, and, using their own rules, designate other medications or no medications for your use instead. At the end of the day, your provider will go through all of the lengthy process of filling out and submitting prior authorizations. They may even spend hours on the phone attempting to justify their reasoning for the therapy that they've designated, and the insurance company will still say no, denied. Only now your provider has spent a tremendous amount of time without pay, and you still don't get what you need. When patients get their care through insurance, they're hoping to save money. They pay for or have insurance through an employer and feel things related to their health should be covered. And they should be able to get good care, not just some one-size-fits-all approach to health. I get it. That's just not the reality. Having said this, providers who accept insurance have agreed to provide care based on the insurance company's required standards of care when they sign the contract with the insurance company to get in network with that insurance. This is why concierge, non-insurance-based clinics exist, to provide individualized care to fit the patient's needs regardless of what the insurance decides. Insurance-based care is never about what is best for you. It's about money. Insurance companies dictate the care you have access to, not what is best for you based on the provider-patient shared decision-making process. At the end of the day, you have to decide what is important to you and what type of health you want.